Okay, Raj, thank you for joining me in this video interview. I'm
Okay.
excited to get your perspective on the pandemic and digital health. In particular, as you founded and run a digital health company yourself called SimplyWait that we'll get into. But without further ado, would you mind introducing yourself, your role, a little bit about the conditions you spend your time treating?
So I am Dr. Rajeswaran. I'm a consultant endocrinologist. So practicing both in the NHS and mostly in the private sector. So I specialize in endocrinology, diabetes, and predominantly in bariatric medicine. Bariatric medicine is taking care of obese people. But I also spend a small amount of time looking after acute medicine in the NHS. So I've been doing this for nearly 25 years. So it's an exciting job.
Absolutely. And what would you say what is it about your role, your job, your work that you are most passionate about? What drove you to it? What keeps you there?
So when I started off as a young doctor, it was just about treating disease where they come with a pain or an infection, you treat them and then they go away. But now as an endocrinologist and an obesity specialist, I'm actually changing people's lives. So it's not just about just treating an illness, the whole life changes. People come and tell me all the time that my life has changed, you have changed my family, and that's the buzz I get. And that's what keeps me going.
Yeah, that must be enormously satisfying. I must admit
That's
that.
right.
I don't
Absolutely.
get that sort of feedback loop, so that must be very satisfying for you. Okay, so just switching up to the kind of pandemic, right? So, what would you? Well, I mean, what did the pandemic change for you, if anything, in terms of kind of consultation or treatment?
Yeah, so as I said, I deal with people with endocrine problems and diabetes. And it's all about looking at the hormones, the blood sugars. And so for me, we quickly, in a matter of couple of weeks, we actually switched over to digital platform. And we use telephones, videos, and all the available digital platforms to communicate with our patients. And that kept us going. But we have learned a lot in the last 6 months. So the way you approach patients is different. And this COVID has actually shaken up the whole healthcare sector. And I do not think that we will ever go back to what we were doing in 2019. So this is the defining moment, the last 6 months. And those who have learned in the last 6 months are going to make a huge change for the future.
Yeah, interesting. So just if we could dwell there for a second. So what role could or should digital play then, I guess, in the continued post-COVID world? What are those technologies and interventions that should remain or should be adopted?
Okay, so the digital world is going to be the fulcrum. And I do not think without the digital world you can survive in healthcare. That's the underlying theme which we have learned. Because in the past we could deal with paper copies and seeing people face to face. But now I think it has to be digital. And answer to your question is which bits, and that's where the issue is. How much of this is a human element should come into play, and how much is automation. So that's where the people who are dealing with digital technology and building apps and platforms, they need to communicate with people in the healthcare industry and the doctors and the nurses and find out to what extent they should have the human element and to what extent there should be automation. And the next important thing is human beings they're a funny species. So it's very important to triage. So it's not like Amazon. You want a book, you get the book delivered. the problem is there are so many ifs and buts to that book when a human being asks. That's
Nuance.
why,
Human beings are very nuanced, aren't they?
exactly, yeah. That's why A&E, accident and emergency, can never be automated. But what can be automated is chronic diseases, which is where the NHS dishes out billions of pounds.
Yeah.
So people should invest money over there in chronic diseases.
Yeah. So what would you, I mean, within that, would you say that there are specific challenges that need to be overcome for the future? And I guess overcome by who and what? Is it for the betterment of society, for health overall? I mean, what do you think where do you think the key challenges are for better health?
So the key challenge, as I just said, is both for the health services, for the government, and for the individual, it is chronic diseases. And that is where we can first make a biggest impact. That's why we can save money. And even for the individual, for example, during this pandemic, what we have noticed is a lot of people were very thankful that I could communicate with them, even though they didn't leave their house. One, they didn't have to spend money by a taxi or car to come to the clinic, pay for a parking fee, and come and see me. So I think the challenge should be trying to address chronic diseases and see where they can automate and where people can be provided a platform where they don't need to deal with healthcare professionals. So the digital platform should be one for the patient and one for healthcare professionals.
Understood. So maybe that's a good point to ask you a little bit about SimplyWait. So this is an initiative, a company that you founded and run, as I understand.
That's right. So 10 years ago, dealing with obese people and diabetes, I found that they kept coming to the hospital and nothing happened to that group. They kept putting on weight. Even if they had lost weight, they would put it back on. And I realized soon that everybody knows what to eat and how to exercise. It's not rocket science. So most of the digital platforms are telling you how to eat and how to exercise. So I wanted to move away from that because it's not helping. In the last 40 years, this country has become more obese. 60% of obese are overweight. And also the recent research shows that it takes up to 9 years for someone to seek help for weight management. Obviously is very pathetic as far as the NHS is concerned. And I know Boris Johnson is very enthusiastic about sorting things out, but I still think they haven't understood the actual problem. So this is where the digital technology world, they can help us, help healthcare professionals to deliver a product which can simplify things and also reduce the cost. So in SimplyWait, what we do is we don't go for what to do now. We go for why. Why is someone doing a certain things? So why am I going and eating a donut, even though I know that I should be eating a donut? And that's where we are trying to do the science. We are working on the science behind it.
Yeah. So how to change the habits to get those embedded?
No, we are trying to find out why did they get into that habit first.
Okay. Interesting. So there's the kind of there's the digital as having a role within better health outcomes. What about other stakeholders like pharma? How do you view them, and how should their role evolve in the future?
Yeah, I think pharma is going to be a big player in this. The pharmaceutical industry would need to help both patients and doctors, nurses. One of the things I'm keen to do, especially in this last 6 months, what we have learned is pharmaceutical industry should support doctors in increasing the knowledge. So educational sessions, if they can build some platforms where knowledge base is being provided. Because in the last 6 months, I've not attended any conference. I missed all the conferences. But earlier this month, I attended an obesity conference in Spain, but that was fantastically supported by one of the pharmaceutical companies. And I had everything available. If I had gone face to face, it was compensated. So pharma to provide educational stuff for doctors, leaflets and promotional material, e-copies for patients.
Yeah.
And also help us to study the digital world, to help us to study how we are providing a service, how we can improve the service. And that's where I think the pharma industry would come into play.
Do you just quickly related to that? So the kind of conference circuit and education. So do you think that's something that can be catered for in a digital capacity, or do you think there's something missing still?
No. So within the conference, there are two elements to a conference. One, to provide educational material and new stuff, and two, to network. That's what the conference does, is networking and providing educational stuff.
Yeah.
So if there's easy, good ways of providing networking for doctors or nurses in the same conference. So we have breakout areas where they can come and meet out. And so we are using a lot of digital cafe rooms where we meet and discuss.
Yeah.
So it's all possible without going to the venue.
Yeah. Yeah. No, it's good to hear. It's good to hear. A bonus question, if I might. So if there was something that you could change about the current healthcare system, and you can think of that in whatever terms you want to, whether that's kind of local, national, global, what would you change if you had a magic wand, and why?
That's $1 million question. But the reason I left NHS was primarily to do that.
Yeah.
So it's not about numbers. It's trying to understand what a patient wants. And what I would change is I would first listen to the patient. And what is happening now is we are not listening to the patient.
Yeah.
Every patient is a number, and it's all about number. GPs are provided 10 minutes.
Yeah.
So if I have to change, I would provide a platform where people are listened to. And that is what people want. As you know, that the mental health is going up in this country. The only reason is there's no one for them to talk to, listen to.
Yeah. No, I agree. It's a symbiotic relationship, isn't it, between the body and the mind? And if people don't feel like they're listened to, then it's a broken solution. Well, fantastic. Raj, thank you very much indeed for agreeing to jump on this quick video call. I did promise that it'd be quick, and hopefully I have been good to my promise. It's been incredibly interesting to get your perspectives on this. So thank you very much indeed again for your time.